Welcome to Your Health. And we are just delighted today to have Dr. Garg with us. We're doing a series with physicians from the Multispecialty Clinic that are physicians from UAB that also in conjunction are with Baptist at Baptist South. And you all are you're the cream of the crop, and we are so delighted to have access to this in our region. And Dr. Garg, have you moved already to Montgomery?
Yes. So we are having 2 apartments and 2 houses at this time. My husband is finishing his fellowship in UAB, Birmingham.
Okay.
So we got a house there, and I am here over the weekdays when I'm working. Got a small apartment here. So.
Okay, and then sooner or later we'll get you both.
Yes, that's what the eventual plan is, and hopefully it will work out for both of us.
Oh, we're delighted.
Well, if you like him as much as you, I'm going to adopt both of you.
Oh, absolutely.
Great.
We'll be happy to be here, and so far, it has been a fun experience helping people. It's really been very gratifying.
Well, we were going to talk to you today. You are an endocrinologist.
Right.
And first of all, give us the definition of an endocrinologist.
Okay. So endocrinologist, as the name suggests, it deals with the endocrinopathies, which is related to the different hormones being produced by different glands of your body. So these are the glands which produce different hormones to keep the body in harmony and to keep it all together for your metabolism, for your calcium, and for different other kind of the hormones which help you to maintain and to live through your day.
Okay. We know that our audience, we've had a lot of people ask us about the thyroid gland. There seems to be a lot of trouble with hyperthyroid or hypothyroid. Could you explain to our audience a little about that?
Absolutely. After the diabetes, which can be type 1 or type 2, and I'm definitely seeing a lot of diabetes here in this area, but I must say that after diabetes, thyroid is the second most prevalent disorder that I have been seeing here. And as you mentioned, thyroid, you can see different things in thyroid. You may have underactive thyroid, you may have overactive thyroid, and you may have nodule, which needs to be further worked up to determine if they're cancerous or not. For underactive thyroid, the most common symptoms are that you feel really tired, which can be with many disorders, but that's one of the most common symptom. But as the name suggests, it's a hypoactive, underactive thyroid. So everything kinds of slows down. You feel sluggish, tired, your bowels, they slow down, you're constipated, you lose hair, and your skin gets dry, and you get cold all the time. So in general, your metabolism is slowed down. And that's when your doctor needs to check for your thyroid functions. And on the other side, your hyperthyroid, as it suggests, it's overactive thyroid. So this is when you are your metabolism is really fast. You are losing too much weight when you're not trying to lose. Some people, they may have heat intolerance because your metabolism is so fast, and you can have tremors, palpitation, racing of your heart, diarrhea, just opposite of symptoms what you get for underactive thyroid. And the third most common thing, and which with the advent of latest technology and advances has become more common, is thyroid nodules. You get scans for different things, and you will have this incidental finding of nodules, and which, depending upon how they look on ultrasound, needs to be further investigated. Usually it is, being monitored, or a biopsy is done just to make sure that it's not cancerous. So those are the basic things that you can have with thyroid problems.
And is it easy to treat thyroid problems as a rule?
Yes, certainly. Most of the time, it's a medication which works for thyroid, whether it's a underactive thyroid or overactive thyroid. But there are other modalities as well. Like for overactive thyroid, you can go for surgeries. There are radioiodine treatments, and for cancer, depending upon what the extent of cancer it is, surgery is definitely the definitive treatment.
And when you're having your yearly examination from your regular doctor, part of that screening is for the thyroid to make sure that there's nothing irregular going on?
Exactly. Most of the doctors, the primary care, they do check your thyroid function test in your blood work. Checking the thyroid function test in your blood work gives an idea if they have overactive or underactive thyroid. but that would not give you any idea about having nodules.
Ah.
Yeah, for nodules, if the nodules usually are very small and they don't give you symptoms unless they are pressing your food pipe or they're pressing your windpipe, that gives you trouble swallowing food, trouble breathing, or change in your voice, symptoms like that. So this is when you get really concerned about something in your thyroid, and sometimes your primary care doctor can feel it on the exam, nodules, because sometimes they're easy to feel and they can feel it and they can order the imaging as needed for it.
Wonderful, wonderful. We have certainly enjoyed having you with us, and we
Same
welcome
here.
you to this region. And
Thank
and
you.
let us remind you again that you do not need a referral. That
That's
you can
right.
call the multi-specialty clinic, and you can make an appointment. We will have the number on the screen. And if you have symptoms that you're concerned about that relate to your hormones, you need to see Dr. Gang. And thank you so much for being with us, and we will be right back.